All right, welcome to this explainer. If you're an MRCOG candidate gearing up for your board exams, you are in exactly the right place. Today we're breaking down the definitive 2023 International Evidence-Based Guideline for the Assessment and Management of PCOS. We're going to transform this massive, comprehensive document into your ultimate high-yield clinical pathway. Our goal here? To make absolutely sure you master these guidelines, understand the fresh evidence-based updates, and are perfectly positioned to completely ace your clinical exams and OSCE stations. Okay, let's dive into this clinical roadmap we're tackling today. We've got 6 parts. 1, international consensus. 2, updated diagnostics. 3, holistic assessment. 4, lifestyle and medical. 5, fertility pathways. And 6, shared decision-making. Starting right off with Section 1, International Consensus and Global Guidelines. So it's crucial to understand that this isn't just some localized protocol. What we're looking at represents a massive, multidisciplinary international consensus. It was led by the Center for Research Excellence in Women's Health and Reproductive Life, and it partners with absolute global heavyweights like the Endocrine Society and ESHR. For your exams, this means these aren't just polite suggestions, right? They are the definitive, evidence-based rules for diagnosing and managing PCOS worldwide. If it's in here, it is exactly what your examiners are going to be looking for. Moving on to Section 2, updated diagnostics and the Rotterdam criteria. We are shifting now to literally the absolute highest yield topic for your MRCOG exams. The diagnosis of PCOS has officially shifted to an updated, evidence-based version of the Rotterdam criteria. For adult women, it's a checklist. It still requires the presence of 2 of the 3 main features. Feature 1 is clinical or biochemical hyperandrogenism. Feature 2 is ovulatory dysfunction. And Feature 3 is polycystic ovaries on ultrasound or an elevated AMH level. But pay very close attention to the critical exception noted here. This is an explicit, evidence-based recommendation. If your patient presents with irregular menstrual cycles and hyperandrogenism, ultrasound or AMH are not required for the diagnosis. Seriously, in an OSCE setting, do not order an ultrasound if the diagnosis is already clinically clear based on those first 2 criteria. Now, what's really interesting about this slide is the formal elevation of anti-Müllerian hormone, or AMH. The 2023 guidelines have totally simplified diagnostic testing by officially accepting AMH levels as a standalone diagnostic marker and an evidence-based alternative to ultrasound for identifying polycystic ovaries in adult women. This is a massive update from previous years. It's a real game changer and an absolutely key point to highlight in your clinical reasoning. But here is a classic MRCOG pitfall, and you really need to burn this into your memory. You must actively contrast the adult criteria with the adolescent criteria. In adolescence, you strictly require both hyperandrogenism and ovulatory dysfunction for a diagnosis. Ultrasound and AMH are explicitly not recommended for adolescents. Why? Well, it comes down to poor specificity. There is just a very high incidence of multifollicular ovaries in that early life stage. Diagnosing an adolescent based on an ultrasound is a surefire way to lose major points on your exam. Just don't do it. Let's look at Section 3, Holistic Assessment, Beyond Diagnostics. The guidelines state this unequivocally. Just read this quote directly from the source. Routine screening for depressive and anxiety symptoms was recommended. In the context of PCOS, identification of psychological features and mental health disorders is crucial. This right here represents a major clinical shift. Psychological screening at the time of diagnosis is no longer considered some optional extra. It is a mandatory clinical pathway. We know women with PCOS have definitively greater depressive and anxiety symptoms. So as a healthcare professional, your examiners will expect you to initiate this screening routinely. You have to recognize the profound impact PCOS has on quality of life and body image. Now for Section 4, Lifestyle and Medical, the Management Phase. Foundational management always begins with lifestyle interventions, but the approach here has definitely evolved. While healthy eating and physical activity should obviously be recommended to everyone to optimize body composition and metabolic health, the guidelines are crystal clear on this. There is no single dietary regimen that is superior to another in PCOS. Patient preference reigns supreme. Furthermore, and this is highly testable, as clinicians we must actively minimize weight bias and stigma. A heavily emphasized practice point in these guidelines is that you must always seek permission before weighing your patients, and you need to explain the weight-related risks sensitively. And this brilliantly illustrates the separation of primary medical therapies based entirely on the patient's specific presentation. If your patient's primary indications are menstrual irregularity and hyperandrogenism, the combined oral contraceptive pill is your absolute first-line pharmacological treatment. you should favor lower dose preparations. On the flip side, if you're targeting metabolic features, metformin is recommended. And note that the guidelines specifically point out that metformin has far greater efficacy than inositol, which actually offers pretty limited clinical benefits. But wait, here is a highly testable, extremely high-yield clinical point. PCOS is classified as a high-risk condition in pregnancy. However, despite its known metabolic benefits in the general population, routine use of metformin in pregnant women with PCOS is explicitly not recommended by the 2023 guidelines. Let me repeat that. If an examiner presents you with a pregnant PCOS patient, do not reflexively prescribe metformin as a standard of care.
Next up, Section 5, Fertility Pathways and Anovulatory Infertility.
Let's map out the sequential algorithm for treating an ovulatory infertility because you will be tested on this. Step 1, letrozole is now emphatically the first-line pharmacological therapy. This is a new dominance in the guidelines, largely because robust clinical evidence shows it results in much higher live birth rates for these patients compared to clomiphene. Now, if that fails, we move to step 2, which includes clomiphene either alone or combined with metformin, as well as gonadotrophins or ovarian surgery. Step 3, the final line, where other ovulation induction therapies have completely failed, is IVF. And a really cutting-edge detail to note here, for these women, IVF might potentially be offered with in vitro maturation. Keep this clear 3-step pathway locked in your mind for literally any fertility station. Finally, Section 6, Shared Decision-Making and Patient Partnership. So the crucial point is that a doctor-dictated approach is completely out. Shared decision-making between the patient and the healthcare professional is a fundamental, foundational requirement of the 2023 update. The guidelines explicitly recommend utilizing evidence-based strategies, such as the SPIKES framework, to deliver news and really support patient activation. Remember, your exam performance isn't just about knowing the drugs or memorizing the algorithms. It's about demonstrating exactly how you elicit an individual patient's characteristics, their preferences, and their values when you're recommending interventions. So, we've covered a lot today. We went through the global consensus, the critical shifts in diagnosing with AMH, the absolute contraindication of ultrasound in adolescents, the new mandate for psychological screening, and the exact steps for medical and fertility management. But, knowledge only actually matters when it's applied. So I leave you with this question to ponder. How will you actively use these shared decision strategies and new evidence-based pathways to change your very next clinical consultation? Because doing that is exactly how you're going to ace your upcoming MRCOG exams. Thank you so much for tuning into this explainer. Study hard, and we will see you next time.